awari abusua nenso yasane yahia papa na mo nyina akwa ba dem ba my health checks na my health checks de ne nyesoa ne saving lives na ye doctor de bia ogi na dwa ene ye di apomudin nkita ho me ankasa me honorable doctor Bobson Ateko ye nenso ye beka yade a de bia meka se yade bia ye ka ho asem ha bia yade ho hia yie papa na yade we nso nenso ye ba beka ho asem yade a eni nipa dinya na kum nipa nkasa nipa do na fa mo ahwere wo mo nkwa afiri se sa yade we hihye wono mo ho a ene wo mo edi enya Abusia sa fe na waba ofidie iso na se na waba YouTube channel iso a odofo mesre wani die mu adase mamodia na subscribe page ade papa de ye bo ho dawuro eno nti wo subscribe page ne nso a na wa mia wani ahye sede be ya opia nso ebenya dwumadi a yedi eho mfaso na onom nso ade abo wonom bra wo TikTok nso a momodia wo TikTok sesie ya na wo YouTube na wo be ko TikTok a momodia se wo be like na wa share page wo TikTok Lily MTV sanso na Facebook nso so ye Lily MTV Instagram and nso so ye Lily MTV dwumadie die ka health checks ho asem na my health checks saving lives ye busa wo say employ ena ya wankasa wode wo hu ko o doctor ho say o pesa wo ye check up. How many times do you go for a check yourself? The bain na wankasa wo se ne edika ko me je se me hwe me video mu a ne ma bi enko yie enu nti me ko hu me doctor na mebusa ne nsam yenu me nsam bi efa me ankasa mapomodin ho odofo se obi a wonta anye saade a na me ka kire wo se bomodin se wo hwe my health checks dwumadi esu bia na wo hwe wie a asem a Dr. Ateko be ka kire wo bia no wo de be ye adwuma na wo de ye adwuma nso no na wo frɛ ana se wo gya wo number wo fi se me ka se wo frɛ de ne na ho yi a nipa e frɛ dɔso na mo gya wo number to your comment section ha na wasɛm a wo ka ho asɛm ehia doctor ana se hia wonti wo busa doctor no doctor be frɛ me show bo jaw bibia wo comment section ha say na doctor obe frɛ na woni wadi enkita ho afa question bia nso a ekire wadwen so efa apomudin ho no nso wo de bomodin ase wo be busa bibia ekire wadwen bia busa na wonti ne ye wa ha yenso ye beba ne abayi wano doctor say wa ye krado say bibia ha wo bia no efa apomudin ho bia no obeboa wo na wanya apomudin papa de na obeya ma wo obekire wo kwan pa nnuro ese wonnum aye vitamins ana hoɔden nnuro aduane nnuro ya hoɔden wo mu obekire wo ne ese wo ye na se etu de den so a obekire wo ba bia ese wo kɔ doctor ko a ese ne fata se wo kɔ ne hɔ a ubenya apomudin ho anu yie nso obekire wo abusia wo hwɛ my health checks with Dr. Bobson Ateko ene ye be ka ho asem asthma eno na ye be ka ho asem ne. Are you asthmatic? Do you know someone who is asthmatic? Say oye asthmatic ana wonim obi a ono so wo asthma dia entwentwen so kra frɛ ne bra page so no mesua de na ne doctor obekire yade a ye frɛ no asthma ho asem. Dr. Bobson my honorable handsome doctor menjeje no ho fama wo ba so obesua apomudin ho asem menjeje no ho afame amade what doctor you look so relaxed.
Thank you.
That's beautiful. Memo akwaba
That's
and over health checks so na fe so megina Steamer Record ni Steam Limited and a Steam group of companies nyina na mu na mada was say watu ho ache menim say bedum rebi no wan kasa be my recommendations doctors are wan for say omo nso ebe omba be sra efidie so na nim sa brede ye una ye twe current ni na efro doctor
Mommy.
asthma ekum nipa
Yeah.
minim kura mate 1212 nipa bako minim man bi or a politician kase pa me te say asthma ekuno one of the filling stations here in Ghana. But my train asthma what it is.
Okay.
Can be for asthma ho chere introduction.
Gotcha.
What is asthma?
All right.
Okay.
That's it. That's very.
You're welcome.
For the opportunity once again.
You're welcome.
So asthma yare no yare bi chronic is a chronic disease. It builds up over time. And I say chronically, like for a long time.
Okay.
And it's not a communicable disease. And yeah, they are obviously the amount. Say be a minimum kasana mo asthma, mama asthma.
Okay.
So it's non-communicable. You understand? And then there's an airway disorder.
Airway disorder.
So it's a disorder that affects your airways.
Okay,
your respiratory system. You can't airway. I just say, respiratory system. No, baby, system na ebuama out me home no. Area affects our system no. Any friend on the respiratory system. But any area is not communicable. You can't give it to some sign OB. Okay. Generally that is asthma. Asthma area so say a bar you generally extrinsic asthma. Extrinsic no and I'm friend atopy. Extrinsic and I say atopy or atopic and intrinsic asthma.
Okay, extrinsic and intrinsic. Okay.
The extrinsic asthma no and I say atopy no. And then usually it affecting in Korean and I say people in their early adulthood and I say very young children. And it has this genetic backing. Family history. If you have a family history of the asthma anyway now, you may also develop it. And it has this genetic association. And then IgE, immunoglobulin E. I think I'll talk about that one as well. So there's this association with the genetic factors and other things. IgE, immunoglobulin, so play important role. The typical, usually in Korea, you come in Korea. And then the intrinsic one. Intrinsic one usually develop in adulthood.
Okay.
So no, it doesn't have genetic association. There's no allergies associated, unlike the extrinsic. Okay. So extrinsic, there's allergies usually when you are exposed to an allergen, now an attack, those kind of things.
Okay.
But for the intrinsic, usually there's no allergen associated or anything, and it usually develops in adulthood.
Okay.
But the major risk factors is like some of these respiratory infections, So usually people get recurrent respiratory infections, those who are exposed to certain chemicals because of when you get exposed to some of certain chemicals and you take certain drugs, a lot of certain drugs like the NSAIDs, they say aspirin, diclofenac, ibuprofen, those who are constantly on such medications, it can put you at risk of the intrinsic asthma. They know the allergic is not really associated to the allergies. Those which are associated to the allergies, the IgE ones, and then the extrinsic and intrinsic is not associated with the allergies.
Okay.
Then the adulthood and respiratory infections, the exposure that you have based on your occupation, in intrinsic one.
Okay, I see. So until now, say baby, your extrinsic and intrinsic. Oh, I see. Wow. Then part of my course sa asthma. They say manyati ase genetic to me deba ni ade but enema ben pa na smefa say intrinsic which is for the adulthood. No.
Respiratory infection.
Say wonya sa infection no na say but what are the other some of the other causes it may ma onipanya asthma so that say nye genetic kra na metumi anya metumi ahwe ahwe yi so.
So look the genetic association like especially for the extrinsic there's this like science is evolving gradually trying to find the exact mechanism or the exact etiology but right now they are just postulates and I has a hypothesis be a war backing one of the most important hypotheses, the hygiene hypothesis.
Hygiene hypothesis.
Yes, hygiene hypothesis. And for the hygiene hypothesis, no, basically the one person I want say for enkwara omunyine yawo mfufuro no, so postnatal yawo mfufuro no, those who are exposed to extremely clean environments, extremely hygienic environments, no, they find it difficult developing their immunity, so a certain arm of their immunity.
Okay.
And it makes them at risk of some of these allergies. So as soon as they are exposed to any allergen biano, the reaction is very serious because their immunity is not so developed. And a friend hygiene hypothesis. And because of that, the asthma condition more common in developed countries. Or more very clean environment, especially from childhood.
Okay.
And then just I would say they are kind of too female and other, but like we are talking about people like extreme clean environment. You don't allow your child to even play outside. You don't take outside. Like always trying to ensure say it's extremely clean. That was one of the hypotheses. That's also known as the hygiene hypothesis. So this is one of the strongest hypotheses so far. I suggest to say like Emma, the development of immunity, some arm affected and trigger some of these things. That is with a genetic association. So as I said already, so basically that is what they've come so far in terms of the main cause of it. But as usual, there are risk factors. There are certain things that can put you at risk of it. So assuming you have a family history of asthma and all those things, and then you begin to have some of these risk factors now, and worsen your risk of getting it. So sometimes we may have the genetic association with the asthma, but you can live your life such that you may not even get any exacerbations or any like attacks. Like, let me say that. So some of the risk factors include like certain medications that you take. Yes. So especially these over-the-counter medications like aspirin, ibuprofen, diclofenac. So they are not really very recommended for patients with asthma because it worsens the asthma. So if you are in pain and you want pain medications, you see especially if you have asthma, you have to see your healthcare professional so that it gives you the appropriate medications that you can take that will not trigger some of your asthmatic attack, that kind of thing. Because usually, so if you're in pain, like paracetamol will do, especially for pain management if you have to take, because some of the NSAIDs in there, they can really affect you. Obesity is another risk factor. Because there's a theory that when you gain so much weight, you gain so much bulky in your chest that it makes it difficult for you to breathe well. So someone who already have hypersensitive airways, now sometimes the airways now putting on a lot of weight. It makes it difficult for the lungs to expand and contract for you to breathe very well. So obesity is also another risk factor for the asthma. Sometimes to lack of exercise at all. Some people do not exercise at all. That can also put you at risk of asthma. So those are sort of modifiable. There are risk factors that you can modify. Another risk factor is like exposure to dust or even allergens. So the allergens, like things that can trigger the asthma. So the more you are being exposed to it,
dust.
Not dust basically. Like most of the time, I don't have an allergen air dust, but there can be other allergens. Smoke can be another allergen. Very good. Even the bed sheets are that's the material normally bed sheets. You can develop allergies towards that one.
Why?
Because material, like because of immunity and American because that arm of the immunity is not well developed. When it's exposed to that material now, the body sees it as a foreign material, so it mounts a severe immune response against it, and then it affects the airways. So material, even paint, all the paint to them can react to it. It can react to almost anything, like beans. Sometimes if you are beans, other food scrap can. So usually recommend that, especially in corona more asthma. One way to help them is you list almost everything that they eat, or so all the food that you eat, just list them down. Every atari or meshano, list them. Try to find out the material on the atari, the baby alcohol, the various activities. Try to list all of them down, and then try to find which of them is the trigger. Do you understand? So you need one way that you can try to manage that. That's it. So we make the list and then try to identify the specific trap. The best way is to stay away from the triggers. So if it is dust, as much as possible, you try to reduce dust exposure to the child. But in a certain dust there, you may always get it. So try maybe can be using nose masks depending upon where the child is going to. So that a bit reduce the exposure. So one of the best ways, like so, the risk factor is the exposure to the allergens. And then one of the allergens is dust. So there's mites. House mites, people react to a lot of them. Even sometimes the pets, no more fear. So if you have dogs at home, cats near that, there sometimes some of the children are allergic to. So you try to list all those things and try to keep the child away from some of these things to see if there can be, if the symptoms progress, then it's likely that that thing may be the allergen that the child is being exposed to.
Wow. So you're asthmatic. So this means that it's a access now baby will trigger free.
Yes, especially specifically childhood. Not just extrinsic. The allergies.
I see. Wow, not just from what you are saying, no more allergies now. Smoke is one of them.
Smoke is
if
one
you
of
can
them.
help me repeat them.
So smoke, dust. Maybe house mites.
House mites.
Okay. So I
just wanted to mention all these allergies that can trigger an asthma attack. So that obi na, because after this I want to know how you can be able to overcome the triggers. So if you can help me outline the triggers again. So
most of the time can be dust, the house mites, the smoking. So if you live areas where people smoke a lot, like where you are a secondary smoker, like really affected, and some people smoke too. So if you're asthmatic, you want to cease smoking because it's also a trigger that can trigger the attack. So the weather. Sometimes weather conditions, so sometimes certain weather, when it comes, the air becomes very dry, very dusty, and then at certain weather there's pollen. You call something pollen, pollen grains or flowers, the flowers to also reproduce. So in certain weather, the pollens become more in the atmosphere. In foreign countries, they're able to detect the amount of pollen in the air. So there are devices that they use to detect the amount of pollen. So they as part of their weather broadcast, they can announce that today the concentration of pollens in the air is very high. So they used that to caution asthmatic. In Ghana, I've not really heard anything like that. But I mean, like that's where they do that a lot. So let you know the concentration of pollens in the air, so that's as a warning for those with asthma. So pollens, so flowers, so basically from flowers.
From flowers. Now Ghana flowers himpo.
Flowers exposed to a lot of flowers. So at certain seasons now, the pollens are being released. They have to be very careful during that time. Maybe also wear nose masks, or you can be indoors during that time so that it doesn't get exposed to the pollen. Until weather comes to the pollen, and sometimes the dry air that comes to the weather because of all this. So the thing is that the airways are hypersensitive. The least thing then it begins to react. As soon as it gets exposed to the smoke and the dust and the pollens like it responds quickly. That's what they call the hyper responsiveness. So there is airway hyper responsiveness. Basically.
I see. Like so we are asthmatic. Nani Dr. Edkain. Baby or hona also ma unya wa attacker. Next you have to do your best to, well, I don't know, doctor is going to say it, but you need to do your best to stay away from these areas where can trigger an asthma or asthma attack. So doctor, moving on. Of course, I know so definitely you come and say they should stay away, but how can I be able to overcome attacking? So because it looks like it's becoming rampant these days. It's becoming rampant. But yes, will be all those. So how can one be able, asthmatic, be able to overcome? Because staying away will be quite difficult. We are in a dusty Africa. Africa itself is dusty, and I'm allergic to dust. What can I do?
So thank you very much.
You're welcome.
You said that okay, I still have but I think I'll say it in a very nice way.
Okay.
So I think with asthma management, you have to be your first, or you have to be your primary caregiver. You have to really understand your body, get to understand your own physiology, get to understand the things you are allergic to, and then you have the initial steps. The initial management will be done by yourself. Do you understand? So that's why for patients with asthma, especially very young children, they need some of these education that we are giving here, so that they know how to take care of themselves. The initial stages before anyone even comes in to assist them, that kind of thing. So for an asthmatic patient, like one of the important things that I can be doing most of the time, try to do breathing exercises. They are really helpful. So I'm starting from, I'll get to other
Okay,
people.
yeah,
So
that's okay.
the breathing exercises are very important. So when you are there, like try to take in breath and out, breathe in and out. Regular breath exercise or breathing exercises have shown to sort of improve your asthma, that kind of thing. Another thing too is that with the dust, one of the best thing you can do, the nose mask. It got to a point we are even recommending during COVID time, like doubling your nose mask. Lately on the news, you notice that like the air in Accra actually like has become very polluted.
Yes.
Even more than India. I was even surprised to see those updates. And it is good that the EPA is doing well to give us some of this information. And then especially patients with asthma or other airway hyperresponsive diseases. You have to be very careful during this period.
Yeah.
So you can wear nose masks. Sometimes you can even double them. Double the nose masks and wear it. So wearing nose masks is very important. Another thing too is that there are medications that people use. You have to learn proper. You see, most of they use the inhalers.
Yes.
I'll talk about the inhalers.
Yeah.
You have to learn proper inhaler techniques. That is like how to properly use your inhaler, which I'm going to demonstrate. I'm going to show. I wish you could get an inhaler around, then we can use it. So I will show the inhaler technique, how to properly use your inhaler and then take care of it to reduce some of these. So you have to always have it with you. Do you understand? One way of preventing or controlling the condition is always have the inhaler with you wherever that you go. I watched a commercial and then someone, because the person doesn't have adequate education, the person felt like just keeping the inhaler with him will protect him from.
Can you imagine?
So when the person even has an attack, it's just in the back. So they write the person to the ER, and then the doctor asked, "Where do you have an inhaler?" And I was like, "Yes, where is it?" He was saying, "It is in my bag." So did you use it? Also, no, I just kept it. So some people are just keeping it, that kind of thing. But you need to have it with you, and then also learn how to use it. The appropriate way of using it, which I'll demonstrate in a few minutes. So that's one way of also protecting yourself, essentially very important. And then regular exercising. Sometimes there's exercise-induced bronchoconstriction, like in asthma patients. When they exercise, they get the attack. Some people, their trigger is exercising.
Oh, is that so?
So such people, there are specialized form of exercises that you can be doing. So not any intensive exercise. So for asthmatic patients who's going to be exercising, usually you take your inhaler, you take some parts of your inhaler before you even start with the exercise, and then usually you don't do so intensive exercise. You do mild to moderate exercising. We don't, because you see, asthma is also obesity is also a risk factor. So don't say because you're asthmatic you don't exercise at all, but you can take the inhaler puffs before the exercise to reduce the exercise-induced bronchoconstriction, and then you don't do too intensive exercises. So you do the mild to moderate exercises to reduce. But the best way is to sort of stay away from the allergen. The best way in management of asthma is to
stay
away from the allergen, especially if it is extrinsic. You understand? And also sometimes there may be an underlying respiratory infection causing this asthma. You understand? So some of the underlying respiratory infections like can be respiratory viral infections. Some viral infections, like they can also trigger this one, just like I've said already. And then the bacterial infections like pneumonia and the rest can also trigger the infection. So we have to be very careful. So usually when you begin to, we'll talk about the symptoms. I'm sure we'll talk about symptoms later.
Yes, we'll do.
But when you begin to produce a lot of sputum, like purulent sputum and all those things, colored discharges, and then you are coughing for a very long time, like such people, the thing is that you are easily susceptible to respiratory infections. You can easily catch some of these respiratory infections. So I mean, like, as much as possible, when you notice that things are becoming more severe than usual, developing increase in temperature, quickly rush to the doctor so that you can start, if necessary, antibiotics therapy for you to reduce or prevent it from getting very serious.
Wow, you are watching my health checks. It's all about saving lives. And I have my honorable doctor in the house, Dr. Bobson Ateko. Auntie and so ade a yesua me doctor wade yakọ asthma mu pa ti wo asthma na wa wo hwɛ ne ekoso wo widie mu wo hwɛ wo allergy sɛde ɛteɛ sɛde quickly na wakɔ na doctor a check you quickly abosua eku batan bi adaroma nti na metumi de my health checks e de brɛ wo omada wo no mo so masene me na metumi de dwumadi e brɛ wo Golden Palace Hotel Limited. Golden Palace was Asamankese. Asamankese nso on wo Jamestown. Golden Palace kroya so wo Lily M Palace Event Center. Event Center papa just a papa bi. Ya ɛhɔ fɛ. Ya bibi a pese wo yobi ada. Betimi aye ɛwɔ Lily M Palace Event Center. Airport Saloon. Airport Saloon no matter room and na oma fa mitiri ho kanyina da season we wono mo se mitidi e wono ma je ho bibia no ase me bowura hwa na omo se ma me kalase etina se na yemfa kalase nguti so airport salon wono mo ya ade dodo na wono mo atu atese nkran ha sei kese me kase me bobo a me nkan wie omo numbers go screen na se bomoden ase tire bia opese wo ye bia no please don't go anywhere apart from the airport salon. Golden Palace Hotel Limited. Say medika ka ho asem say e wo Asamankese Jamestown ti mensan kra so nka bio. So and a steam group of companies. Steam group of companies muamu so na Steamer Record, a record label. Yeah, dwumadi a wono mu die me ka say me ka wa ha me wie. Ebi na yete ha ya yoyi na odofo sa record label yi wono mo boa mansan papa in fact record label yi ye nyoma de boa Ghana mine wiase manyina da sa wo pe steam group of companies mwa na wo san so pe steamer record mwa nko ade a fa wonom numbers ye go screen na se na egbo modern ase wo be frɛ wo mo na mo bi a wo pɛ ɛfa akwan yɔ ho adansie ho nimdie adansie ho ne akwan yɔ ho afutuo saa so na entertainment industry mu nyoma ya de buo nyina da no frɛ wonom na onom enye wo mmoa Lily's Bead Hub de oya ne se onwene beat a yɛde to ye komu yɛde to ye nan yɛde gu ya sene ye nsa ye ba bia ada Lily's Bead Hub de a traditional and as African traditional bead production dia mesro and for any nkyere ba bia Ghana ha say Lily's Bead Hub wo mo numbers no say dem aka no ego screen na say omo dia na fa na frɛ wonom na mo bi a opɛ efa bead hu bia no wonom ede amao abusua na adesua yesua eyesronko my health checks dear yade bia wo wiase bia wo pepa mu asemati dia hwe saa adwumadi so my health checks with me Dr. Papa B Dr. Bobson Ateko ye be checho yade ben yade bia ye be ka ho asem fidie so yade bia nti se wo ha na onim godofo bi a wo yade bi emu ohaw na etete no a wo se won true mika na omra Facebook, YouTube, TikTok, all the social media platforms so no omesua my health checks one ka samoson for him ma media na afro songstress Lily M a.k.a. Maame Colors me na dwumadi e de ho chia me doctor
Yes.
mo akwa ba bio ba relax me rattle na doctor so relax doctor wakasa bebre efa asthma ho na me musa say signs and symptoms ben na me am ye asthmatic yi me hu say anase me nyina bi kura no me hu say me yanya asthma nti say me to America call me doctor ho na me wo bi nso na me benya attack am pese ne nyina bomba ko me wo bi me benya attack die na me hu say ma attack ne ba na me ankasa metumi aso ano me nya asthma ne bi Nanso, ba me with mu. Better na me hu. You can answer one after the other, please. Thank you so much.
So, with regards to the signs and the symptoms now, during the asthma, one of the prominent signs, your friend wheezing, you begin to wheeze.
Wheezing. And no
sanity. So when you wheeze, like there's like a whistle sound in your breath.
That's
So and it would like a high pitched sound. I don't know, say be our typical asthma patients, no.
Okay.
Like, do you know what I'm trying to say? So when you are breathing you produce some high pitched noise and you're kind of wheezing. So you wheeze. So it sounds like like wheezing, that kind of thing. So it's very typical in asthmatic. Sometimes you don't even have to use stethoscope to listen to the chest sounds. Like you can actually hear it. The obena. And your friend wheezing. So there's wheezing, then the cough. Sometimes because of the hyper responsiveness of the airway, they begin to cough. Ideally, it's a reflex mechanism. When ideally it's only air that's supposed to go through your airways. But if there are other pollutants, raw airway, the normal reflex is for you to cough. But for asthmatic patients, no more extra response, like it's hyper. The responsiveness is hyper than usual. You begin to cough more excessively, that kind of thing, when you're exposed to it. So you cough a lot. Sometimes even bring out sputum and other things as an attempt for the body to expel the pollutant that you've inhaled, that kind of thing. So coughing is also very typical there. And that point, sometimes you begin to sweat. The chest becomes very tight. You begin to feel chest tightness. So typically you see them with a raised chest. I say, me cry. So breathlessness. I say you find it difficult really breathing. When it gets very severe, it will be cyanosis. Cyanosis, no, like you become bluish because air. Then the oxygen gets into your blood. Then your blood will circulate the oxygen in the body. But if oxygen is not reaching certain parts of your body for a long time, that place begins to look a little bluish. When your friend is cyanosis, you say one I say a blue. One only when you blue, so fingers begin to look blue. And I say you are asphyxiating. I say oxygen is not reaching certain parts of your body.
I see.
That can be very dangerous. So like there are stages of the asthma, like in terms of the acuity, so that's like in severe stages, or life-threatening asthma, acute asthma, sometimes you can have some of those cyanosis.
Acute, life-threatening. Okay.
So like you can be an asthmatic patient, but you can have an acute attack. And then the acute attack, it can be mild. The acute attack can be mild.
Okay.
It can be moderate.
Okay.
It can be life-threatening, right? And it can be severe and life-threatening. That kind of thing.
Okay.
So depending upon the kind of symptoms that you're having. So when you go to the emergency, like in acute situation, where you have to be taken to the emergency, for the mild and moderate one, there usually you can manage it at home. But for the moderate, for the life-threatening, right, and then the fatal, near fatal, some of them is like the classification near fatal ones. You have to be managed in the emergency room. So depending upon the kind of symptoms that you're showing, that's where you know which way you're going to do. So basically, those are the kind of the symptoms that are going to be seen. So the chest tightness, difficulty breathing, that kind of thing. And the coughing, the wheezing. The wheezing that comes, like you hear noises out. So difficulty breathing. It becomes very difficult for you to even expel air when you are breathing, that kind of thing. Like uncomfortable, and then the discomfort causes that sweating, chest pain, and all those things. So as it advances, you notice that your heart rate begins to even increase. So there's palpitation because your heart rate increase. Because the body will feel like you are not pumping enough blood. That's why you're not getting the oxygen. So there's palpitation, and then you get tired. You easily get tired, that kind of thing. And in very severe situations, like they find it difficult to complete one sentence. So as me, I want to say, my health checks. Okay, my health check. Because it can't complete one full sentence. So if you are with a child who has asthma and begins to exhibit some of these things, Ubusan has said, ask a question, the person can complete a full sentence. That the person is having an exacerbation. So at that point, you have to act very quickly.
So now we are on, or you are hammering on those what you would do if you are
the acute setting.
Okay, you are getting an attack.
Exactly.
Okay.
So
okay.
if you are getting an attack, as much as possible, if you are in an environment where the trigger is, first of all, you move away from where that environment is. So assuming you are in a lab, assuming where you work, that you use a lot of chemicals nowadays and you are getting it, move away from there. If you are outside where there are a lot of dust, as much as you move to a place where there's less dust and everything. So when you move away, you need to have your reliever. So the reliever is in the form of an inhaler. You need to have your, that's I said already, you always have to have it with you because that's the first thing that you'll be doing, you use for the relief. I'll talk more about the reliever. So you need to have the reliever and then know the proper inhaler technique, which I will demonstrate. You need to know the proper inhaler techniques and appropriately use the inhaler. So I'll show you the number of times you use it, how often you use it, and another thing when I'm explaining the inhaler technique. So you need to have it with you and then use it. So if you use it after some time, maybe about 15 minutes maximum, you're supposed to feel better. But after 15 minutes, still you're having symptoms, then you have to rush to the hospital. But ideally, in a setting, you don't really do it. But I mean, everyone is supposed to, every patient who has been diagnosed with asthma, especially young children, supposed to have what is known as an action plan.
Action plan.
An action plan.
Okay.
So an action plan is like a written document of what to do in what situation. So it is nicely listed. Say if you're having this and this and this sentence, do this. If this then this and this happen, do this. This and this, take this drug, take this drug. So every patient, asthmatic patient, is supposed to have an action plan. So if you are an asthmatic patient,
whether you are old or you are young,
yes. So especially if you usually get the symptoms, you need to get an action plan so that one, before you even go to the hospital, you get to a stage that they tell you to even call 911 or something. All on the action plan. So if it gets to a certain stage where you have to go, your action plan will tell you that, okay, at this point I have to go and see my doctor. Then you quickly get where to go. So having an action plan is very helpful. This is also to my fellow healthcare professionals. As much as possible, if you have asthmatic patients, try to develop an action plan for them so that you make things very easy for them. You know, sometimes they get confused. At that point, there can be confusion because you may not even have enough oxygen reaching your brain. So it's like your cognition and thinking ability. So at that point, you don't really know. But if you have an action plan where it can tell you that when you're having this and this and this, do this, especially with very young children, it makes things very easy for them.
Okay. Wow. See, I think we all get to know what we have to do when we have or about to have an attack. What we have to do. Doctor has just emphasized on that point. Say, you need to check where you are. If you are in an allergic environment where you quickly get allergic to the environment, you need to stay away from that environment so that you can also protect yourself. You need to get your inhalers with you so that when you are getting an attack, he's going to demonstrate to us how the inhaler is supposed to be used, so that at least when you are getting an attack, you know exactly what to do with your inhalers so that you can also save your lives. So doctor, you've laid more emphasis on an asthmatic patient who is about to have an attack. But what about those who do not even have the asthma at all?
Okay.
And then, what science kakra in some, briefly, if you can just let us know what, because me I'm a TSM but nobody, no one knows what is going to happen the next minute. So I can also be guided,
So as I said already, asthma, the asthma disease is not a communicable disease. It's not a disease that maybe you are close to someone who have asthma, so it means that the person will give you that. No, it doesn't work that way. So usually for the extrinsic that I've mentioned already, you may begin to notice the symptoms in your childhood or your early adulthood. So you notice the symptoms coming about, and then there are several diagnostic procedures like when you are supposed to diagnose. So they can do spirometry, the blood test to test for certain immune cells like the eosinophils, neutrophils, and all those things. There are a number of tests that can be done to diagnose the asthma. So if from childhood you begin to have some of these airway responsiveness, like hyper responsiveness now, you can quickly get the test done so that you get to know like if it is, then you know how to go about the management.
Okay.
Then if you do not have it, because of the intrinsic one, which you can develop in the adulthood, if you do not have, and you are someone who gets a lot of respiratory infections, you really get, or you work with irritants.
Okay.
You've got the nature of work that you do. Maybe you work in an industry where you produce chemicals, or you work in a perfume industry where you produce a lot of perfume. Perfume is also one of the triggers.
One of the triggers. Yes. Perfumes.
So if you work with strong fragrance, because of the some people, those who prepare detergents, lab technicians, those who work in labs and other things. So when you work sideways, that can be a trigger.
Okay.
So such a person begins to have some of these symptoms. You can also get diagnosed, that kind of thing. So if you feel go and see your doctor, so I can get diagnosed and protect yourself. But one of the best things to do is to stay away from them.
Oh, okay.
So usually when you work with some of these chemicals and begin to get some of these symptoms, that's getting very bad. Please, you can protect yourself. Use very good nose masks to protect yourself and other things. Or if you can change career or find
something
a less less irritative environment to work.
Dr. Ghana, Africa, said a common delivery.
I can imagine. So
still work and die than to protect
the masks. The nose, you have to utilize the nose mask very well to protect yourself. And then when as the weather changes, that's what I'm saying, get to know your body. As the weather changes, you know how to protect yourself. So when it's getting very cold, you protect your chest very well. You wear clothing that covers your chest so that it doesn't exacerbate it. Because the cold weather can also trigger the allergy. So when it's getting to the cold weathers, some people may not have asthma. There are a number of airway responsiveness, responsive diseases. So if you are someone, now it's not a typical asthma, you have some of these things. When it's getting close to the season, you have seasonal rhinitis, where that's near the or when the weather is getting cold and other things. Protect yourself. Know when to use nose masks, when to cover your chest adequately, and then at night, like when the weather is very cold, you have to cover yourself with clothing so that you protect your chest and other things. These are a few things that you can do. But for such people, if it becomes rampant too, you can also put on some medications to protect.
I see. You are for doctor. What can you I can't do another. Also, a fay na one as all suspect. Say, oh, yenya, yadi be said, you are canina, oh, boa, basa, boa, ten, oh, means so. Bibia, for nanubia, na koyas mama. Now, so quickly, now, my health checks, yes, say, but more than a doctor, now on check you and she say, we all right, na. Abia o yenya asthma na o ma pentem apedu papa bia na wada so na also ode abo ho ban. Doctor, how do we use the inhaler, if you can quickly help us or demonstrate it for us to see?
If I'm going to talk about the inhalers, so let me see. Let me quickly open this one. So this is how. So typically there are different forms of it, but typically in our setting, this is the kind of inhaler that we usually use. So this is the canister. Comes with the canister. So this is what contains the drug. This is what has the drug. That's the canister, and then this is the container, the canal that you use. So this is the mouthpiece. So the mouthpiece can be covered and opened. Yes. So this is how you use it. So before you use your inhaler, first of all, you put it in an upright position like this. So in an upright position, then you shake. You shake it to mix up the powder. So because this contains a drug, so it's a pressurized drug inside there. So you shake it to mix it up. So after shaking it, you hold it upright. You take out the mouthpiece. Take off the mouthpiece. This is the mouthpiece. You take it off. Then you prime it. Prime it means you press to see if it comes out. So the priming is you have to press to see if something comes out. So you can press. So you notice that something came out. Meaning that it has been primed. Meaning that it can work now. So the next step that you do is that you open your mouth and put the mouthpiece in your mouth, in between your teeth. Do you understand? So you put it in between your teeth, and then cover the mouthpiece with your lips. So first of all, put it in your mouth, right, in between your teeth, but not necessarily bite it to the shirt, like to be in between your teeth, and then you use your lips to cover the mouthpiece like as a seal, to seal it up. So before you put it in your mouth, make sure that you take out, we breathe out. So breathe out before you put it in your mouth. So let me go over the steps again.
Okay,
So
please
first
go
of all,
again.
you hold it in an upright position. You shake it. Do you understand? After shaking, then you prime. So priming meaning pressing to make sure that it's coming out, it's working. After priming, then you exhale. You breathe out. So when you breathe out, you put the mouthpiece in your mouth. Do you understand? In between your teeth, and then you cover the mouthpiece with your mouth to form a seal to cover it. So after forming the seal, so you begin to take in a deep breath. So as you are taking in the deep breath, then you'll be pressing the canister down to release the drug. So you press the canister down to release the drug this way. So as you are breathing, taking in a deep breath, you'll be pressing as well. So depending upon the severity of the attack, you may use 2 puffs. So as you are breathing in, then you press 2 puffs. So as you press, then you take in a deep breath, and then you hold your breath for about 5 seconds.
Okay.
So when as you hold your breath, you can take out the canister, or you can take out the inhaler from your mouth, and then you hold your breath for 5 minutes, or as long as you can, as long as you are comfortable with. After holding your breath, then you breathe out gently. But it's important to hold your breath so that the drug can work in your airways to reduce the airways. And then you breathe out.
Okay.
So after taking breath out, so if after doing that you wait for a few minutes, about a minute or two, you're supposed to get some response. Like you're supposed to feel a little better. If you are getting better, it's not adequate, you can repeat the steps that I mentioned. You can repeat the steps until you are better. So you can do up to about 10 puffs to make sure that you are fine during that trigger. With regards to the drug, the usual one we use is the salbutamol, right? And the active drug that we use about. But now recent evidence is suggesting that like continuous use of just the salbutamol can be very dangerous. Like as in like it produces more, there's more risk associated than benefit. This is like salbutamol is really good. It doesn't like you don't use it, but you don't use it so often. Do you understand? So if you use it so often, over time, there's what's known as down regulation of the receptors. No, I told you the drug is supposed to bind to something for it to work. There's down regulation. There's the new guidelines. That's the GINA guideline suggesting all these things. So now the inhalers, they are very nice inhalers. Now the Symbicort, like example, a brand is a Symbicort. Symbicort contains the steroid.
Is that a brand?
Symbicort is a brand. Yes.
And you are promoting a brand on my show. They
It's
are not paying for it.
I mean, like
I'm sure it's okay.
Yeah. If I mention the active ingredients, like you may not know.
Oh, it's okay. It's fine. It's fine. Maybe after here, they will be able to communicate later.
So they contain corticosteroids. Do you understand?
Okay.
So they cause ICS and then formoterol. Do you understand?
Right.
So budesonide contains budesonide and then formoterol.
Okay.
So the new guidelines suggesting that this Symbicort inhaler can be used, example, like a brand is the Symbicort. These ones, the ICS formoterol inhaler, can be used as an inhaler and also as a preventive therapy. So salbutamol here is only a reliever. You only use salbutamol when you have an attack or an exacerbation. You don't use it when you do not have an attack because it doesn't give you any other benefits. So the only benefit that salbutamol is giving you is to open up your airways so that I can breathe nicely. That's the only benefit you are getting from salbutamol. But unlike the salbutamol, if you have to use the ICS formoterol inhalers, you can use it as a reliever. It will give you a relief and also for your maintenance therapy. So that one you can be taking 1 puff or 2 puffs twice daily, every day. Do you understand? To prevent an attack. And then also in situations where you get an attack too, you can use it as a reliever. And then that one has shown to improve asthma outcomes in patients. Reduces the rate at which the remodeling is occurring, like damage the airways and all those things, as compared to the salbutamol alone. Do you understand? So now you can use salbutamol as a reliever, but you may have to get that one too. But in order to save cost, you don't have to have multiple inhalers. If you get that one, like the ICS formoterol inhalers, do you understand? If you don't understand, you can see your healthcare professional. I can assist you with some of these inhalers. Some of them are designed just like this. Others still have different shapes. So if you get those ones, you can use them as these are new current guidelines from the GINA, the asthma guidelines. So those ones offer better benefits, than using just salbutamol alone, especially for someone who gets a lot of frequent attacks. But someone who does not get a lot of attacks no frequent, maybe you get maybe every once 3 months or something, such a person is fine to use the inhaler, the salbutamol inhaler, because that one uses once in a while. But people who get frequent attacks and other things, like you have to use the salbutamol multiple times, and then that has shown to the risk outweighs the benefit in such patients. So it's better to use the ICS formoterol inhalers. And then there are other medications that you add on that. So it's not just the inhaler that we use. There are oral medications too that can be taken to reduce, depend upon the severity of your asthma attack. But so definitely when you see your doctor, they can assist you with some of these things.
Wow. I think that today's information is do I say vital?
Very vital.
It's very, very vital. Yes, it is vital. And so person unya information ni bebree. Doctor can be about salbutamol. Na me hu say other ones are potent, more potent and more beneficial than salbutamol. It's not saying salbutamol isn't good. It is, but our body, you know. I think that, can you help me with the name again?
One of the major common brands in Symbicort.
Symbicort, no? You just mentioned Symbicort. I'm not advertising that product.
But the actual drug is budesonide named formoterol. There are two drugs inside.
Oh, okay.
Budesonide and formoterol.
Okay. The American Kusiane said, doctor has said so much. He has said a lot. I never thought, say, you bet be crowd asthma, but say you giant asthma no kwa hwe e bedi be 4 days na ida ho ka wasa, because in some asthma no e do so yi. However, please leave your comments if you need help, if you need answers to your health questions. Please leave your comment in the comment section, and then we will get back to you. So it was serious health issues, not necessarily but health issue just leave your comment. Then if you think it's so severe that you want to see the doctor urgently, leave your number there and we will call you and then invite you to have a tete-a-tete with you. All too soon. We are coming to the end of this very, very important segment. But remember, doctor, so am I any final words and some guide, or if you can also add the vitamins that you should be taking when you are asthmatic, and the food that you should be eating and what you are not supposed to be eating, add them to it so that we can it will be a package.
So thank you very much. Usually asthma occurs in very young children, do you understand? And then such very young children, they need a lot of guidance from their parents or their guardians. So if you have a child who has asthma, you have to be you have to close to the person, encourage the person, educate the person on like some of these things I've said, like encourage the child to, you can watch and then explain how to properly use the inhaler, do you understand? And then any other medication that you need to be taking. And then as a child, press on your healthcare professional to get you an action plan for the child, very important, so that you know what to do at every point in time when something is going on with the child too as well. And then these new recommendations that I'm giving you from the GINA guideline, the new GINA guideline, GINA guidelines, you can also talk to a healthcare professional about it, so that they can also consider making changes to the therapy for your child or for yourself, so that you can make such changes to improve your outcomes. There are a number of things that you may not be able to talk about here. That's why it's important to leave your comment section. There are, aside the inhaler, there are nebulizers that you can also use. You can be trained on how to use a nebulizer, especially those who are already healthcare professionals, so that you can assist your children or your wards at home and all. So you can leave your comments down there. As much as possible, I'll try to answer some of your questions, and then let's stay healthy. Thank you.
Good. Thank you so much. But are there some vitamins that you should be taking?
Yeah. I mean, generally, you have to be very healthy. You have to ensure that you have adequate immunity, because you are prone to some of these respiratory infections as someone who has asthma. So you have to ensure that you're always healthy. So the mild to moderate exercising, the fruits and vegetables for the children, as I already say, and the vitamins. So you can get the multivitamin packs for children. There are some in the form of gummies. that you can be chewing, that they are very palatable, that children would want to take. There are a lot of gummies and other things. Like you can, when you leave a comment, I can give you specific brands or specific recommendations that are really good, so that you can be giving to your children regularly, and then so that they can remain healthy, so that they don't get some of these respiratory infections.
Vitamins for adults?
For adults too, yes. Like I mean, like
they should.
When you leave a comment, I think I'll assist you specific brands.
Thank you so much. I'm sure say and now so what's here at dear free and then so your topic I treaty which is asthma. All too soon we've come to the end of this all important segment. I can asthma I've learned a lot and I'm sure you've also learned as well. Just leave your comments and the doctor will get back to you. He will come here. He will come here to answer all your questions and then leave a contact number if you think that you really want to talk to the doctor, and then he will call you. Yes. This is your one and only Afro Songstress Lily a.k.a. Maame Colors. And then so you may know. That's a ne. Bye.